Hi, and welcome. If you're watching this, your dog has tested positive for heartworms. First, we want you to know you're not alone and there is hope. We'll walk you through exactly what heartworm disease means, the treatment options available, and how we'll be here to support you and your pet every step of the way. Before we begin, let's talk about what heartworms are. Heartworms are parasitic worms spread through the bite of an infected mosquito that can affect a dog's heart and lungs if left untreated. The good news? Heartworm disease can be treated. The first step after a positive test is to confirm the diagnosis. Once confirmed, we start your dog on a moxidectin based heartworm prevention. This protects them from any new infections while we prepare for treatment. We also prescribe a 4-week course of doxycycline. This antibiotic weakens the heartworms and makes treatment safer. It's given twice a day for 4 weeks. In most cases, it doesn't need to be repeated, though occasionally it may be recommended later, depending on your dog's health. When it comes to treating your dog's heartworms, we have 3 options available. The first is our gold standard. This is the most effective and safest treatment for your dog. First, we will do lab work and chest x-rays to grade the disease and check for any complications. Then your dog begins prevention with either Pro Heart 12 or Credelio Quattro. After finishing their course of doxycycline, we start the injection series with a medication called Diraban. Here's how that works. Your dog comes in for the first injection on a Thursday and will stay overnight so we can monitor them. They will go home with medications including prednisone, gabapentin, and trazodone to manage inflammation, pain, and to keep them calm. After the injection, it will be very important to keep your dog on cage rest. Cage rest means very limited activity, short walks, and keeping your dog as calm as possible. They'll need to remain on cage rest for about 30 days while the medication takes effect and eliminates the heartworms. About 4 weeks later, they will come back for 2 more injections, given 24 hours apart. After treatment, we retest at 6 months. Most dogs are negative at that time. However, if not, we retest again at 9 and 12 months. On the rare chance they're still positive at 12 months, we repeat 2 more injections. Option 2 is a 2-dose protocol. For dogs with mild heartworm disease, such as no symptoms, grade 1 or grade 2 disease, or dogs adopted from Southern Pines in good health, we can sometimes do a shorter heartworm treatment protocol. In this case, we skip the first injection and give only the 2 back-to-back injections with the same medications and cage rest period. Retesting is done at the same 6, 9, and 12-month intervals. The third option is slower and less effective, but it can be appropriate in certain situations. This treatment option involves giving the 4-week course of doxycycline, then continuing with monthly moxidectin prevention in the long term. We recheck every 6 months or sooner if symptoms appear. This approach does not clear the heartworms as quickly, but it can be safer for some dogs. With all 3 treatment options, it's very important to remember that any new coughing, difficulty breathing, or sudden changes should be treated as an emergency. Heartworms can cause serious complications, even death, until they are completely gone. If an emergency situation happens during clinic hours, Monday through Saturday from 9 to 2, please bring your pet directly to us. If it happens after hours, please call our after hours number or go immediately to your closest emergency vet hospital. Our goal is to get your dog through heartworm treatment safely and to help them have a long, healthy, happy life. The gold standard treatment option gives the best chance at eliminating heartworms completely, but we'll work with you to choose the treatment plan that's best for your pet and for your family. Thank you for trusting us with your pet's care. Together, we can give them the second chance they deserve.